Hi, my name is Mary Haas. I'm the prevention coordinator for the Medfield Cares About Prevention Coalition in Medfield, Massachusetts. Our coalition has been working with CES since about June of 2021. So we've been with them for about 7 months, 7 or 8 months so far. So the types of activities that we've done so far with CES include, a number of things. We are currently in the process of creating a parent survey to mimic our youth risk behavior survey in town to figure out more about parental attitudes towards youth substance use. And actually, in order to get ready for this project, CES has trained our coalition about how to run focus groups as well as key informant interviews. We've carried those out. So in addition to building our capacity, they're also increasing our capacity by using their own skills. So what we were able to do was learn from them, from the folks at CES, to get their expert advice, and then to go into our community and carry out these focus groups and these key informant interviews, and then not worry about how to deal with the data on the back end. So we were able to make those connections and those relationships and build our skills in our community. And then we bring our data back, and the CES team really, they crunch it and they give us reports. So it's a much more manageable way to do this work, knowing that, we have experts in all sorts of fields. And so CES has been really valuable to that effect. They've also been instrumental in advising. We often don't just use them for evaluation needs, but we say, we know you understand prevention work. And so in this case, we're hoping to get data about this topic for this reason and use it in this way. What do you think about that? Is that the best practice? Is there anyone else you think we should include? So their expertise goes beyond just data. And I think that's honestly the most valuable part of this partnership, which does feel like a real partnership. So the work we've been doing with the CES team has aligned, perfectly with our CADCA models. Obviously, as CES is part of CADCA, they tend to have the same breadth of knowledge or more, right, than we do after going through the National Coalition Academy as part of the DFC grant requirements. So in being involved in that portion of my education, as well as many of the prevention coordinators under the Drug Free Communities grant, CES is uniquely positioned to really support. As I had mentioned, or as I would like to mention, really, we tried to work with other evaluators, and we found ourselves having to explain over and over again, yes, I understand you do it this way, but we are comfortable doing it this way. This is how we learn to do it. And CES has really allowed us to not have to relearn a new method to do the same thing. We've been able to take the lessons and the skills that we learned through our National Coalition Academy and through our other prevention trainings to just kind of fit right into their model of evaluation. CES's impact on the work of our coalition has been huge. They have helped us to not only maintain a trajectory towards our goals, as mentioned in our logic models, to really keep us in line with our strategic plans. So what they do is they're looking at big picture. We've got a lot of advice around how to incorporate evaluation and data collection and dissemination and all of that within the framework of these programming and other outreach efforts we have. So what it has done, I think, is really, it's put the meat behind the work we're doing, right? It's the footnotes to everything we're doing. We're doing the work on the ground, and CADCA is helping us to tell the story of the impact of the work. So what they have done in essence is actually exponentially increased our reach, right? And we've only been working with them for 7 or 8 months, as I mentioned, but I could already tell that the impact is going to be huge. It's allowed us to take what we've done and synthesize it into a message that speaks to people who think about data, right? So those government folks, the boards of health, the school committee, parents, data speaks. And CADCA CES team has been super effective and is really wonderful at being able to package that up in a way that speaks to your community.